Septoplasty, submucous resection and turbinate surgery. What is the nasal septum and what are the turbinates? The septum. The nasal septum is the partition that divides the two halves of the nose. It is made of cartilage at the front and bone at the back. It is covered by a lining called mucosa. It is rarely perfectly straight. It is slightly crooked or bent in over 80% of people. Sometimes the septum is so bent that it blocks the nose and makes it difficult to breathe. What is a septoplasty? If you have a very bent or deviated septum, and this makes it difficult to breathe, we may do a septoplasty. A septoplasty is done through the inside of the nose. The lining of the nose is lifted slightly and the cartilage is trimmed and straightened. We hope to make the septum straight, making it easier to breathe. What are the turbinates? The turbinates are rolled, spongy, fleshy bones inside the nose. Sometimes these can become very swollen, usually due to inflammation, rhinitis, which can make breathing difficult. What is turbinate surgery? In this surgery, we use diathermy, which is safe and controlled burning to the surface of the turbinates. Sometimes we also break the turbinates at several points. Both of these two techniques can make more room for breathing. Medical treatment, such as nasal steroid spray, is recommended before considering surgery. If the medical treatments fail, then surgery may help to reduce your symptoms. What will happen before my operation? You will need to come to a pre-operative assessment clinic which will assess your fitness for the surgery. Here we do some swabs checking for infection, request any necessary tests, e.g. an X-ray, an ECG which is a heart tracing or blood test. You will meet with the ENT surgeon to discuss the operation in detail, including the risks and benefits, and then he will take your consent for the surgery. Your surgeon will also arrange for you to have pictures of your face taken before your operation. What will happen on the day of my operation? On the day of your surgery, you will come to the ward or wait in the day room and the nurse will do some basic identity checks. You will then be seen by the anaesthetist and your consultant before you go to surgery. What about the anaesthetic? Your surgery will usually be carried out under general anaesthesia. You will be asleep during the operation. You will be asked to stop eating and drinking from midnight on the day of your operation. What happens after my operation? Usually you can go home on the same day, but sometimes people may need to stay overnight on the ward. Usually we use a pack in the nose which dissolves after a few days. Using a saltwater spray, Sterimar, can make the pack dissolve quicker. You may be given other medication to take. Make sure you follow the instructions given to you about the medication because it will help reduce your symptoms. Your surgeon may arrange to see you in the clinic 6 to 12 weeks following your operation. Patients are usually advised to take 2 weeks of rest following their operation. You should avoid contact sports for at least 6 weeks to avoid knocking your nose while the bones are still healing. Are there any risks with the surgery? There are risks with any surgery, and we need to tell you about the common and rare but serious complications of this particular procedure. Common complications. Bleeding, but it is usually controlled during surgery or with packs. The nose might feel blocked after surgery. This is due to swelling in the lining of the nose. It could also be due to the dissolvable packs which we leave in the nose to help it heal. Because the septal cartilage has memory, it can go back to its original shape or bend again. You may experience numbness of the tip of the nose or the upper front teeth, but usually this resolves after a couple of months, but sometimes it can persist. Crusting in the nose may occur, especially with turbinate surgery, but usually responds to nasal douches with sprays such as Sterimar. The nose may slightly change shape. Rare complications. Bruising of the septum, called a septal hematoma, occurs when bleeding persists underneath the skin flaps of the septum. This is a rare complication but can be drained. A perforation or hole in the septum can occur. It is rare but it causes problems like whistling, bleeding or crusting, and then further surgery may be needed to close the hole. Infection is uncommon but can occur and is treated with antibiotics. You may experience a reduced or loss of smell, but this is a rare complication. An important note, this operation is designed to help the function of the nose, not the cosmetic appearance, as we are not allowed to do this on the NHS. It is very hard to give an accurate description of what the nose will look like after the surgery. It is important to have a realistic idea of what the nose will look like and to understand that a perfect looking nose is not always achievable. However, we will do our best to make your nose look as normal as possible. If you have any other questions, your ENT surgeon or nurse will be happy to answer them. The Patient and Advice Liaison Service offers help and advice to those who have concerns about the treatment, care or support they have received. You can contact PALS on 01752 517 657. Thank you.